Ensuring a fair and transparent surgeon access system is incredibly important. And this is what allows you to make sure that you're seeing all the patients that you need to see, where you need to see them, and the surgeons feel comfortable and confident that their patients will be well taken care of in your institution, and they'll get the access that they need to be successful and productive surgeons within your institution. By setting up a subcommittee or a committee specifically based on surgeon access that reports to a broader OR governance committee is a very effective approach. And within this surgeon subcommittee, they are making the OR director is involved, anesthesia is involved, and they're making very tough decisions on who should have access to which rooms, when, and where, and sometimes for what types of cases. This is critical in terms of robotic utilization as well. So how we're using our robots or certain rooms within an OR that are more favorable than others due to size or something of that nature. And this needs to be an organization where the surgeons are holding the surgeons accountable. We find that cultural friction happens when it's the OR director having to hold the surgeons accountable without surgeon support around that. And so it may be the OR director that's communicating it, although we prefer that it be the surgeon chair. That at least the surgeon, that OR director feels that he or she has the support of the surgeon. So this committee should be setting the rules, defining the KPIs, what is urgent, what's emergent, what is the utilization, the prime time utilization or the block utilization that needs to be achieved in order to maintain your block, and what's the communication path or the warning path if someone's not doing that, and how do you hold them accountable? Because you really have to hold people accountable in order for the surgeon access structure to really be fair and transparent. What we have found at most of our clients is they get about a 20% increase in prime time utilization, where you are able to see more patients with the same amount of resources. And this is incredibly helpful when patients are typically waiting 3, 6, 9, 12 months for a surgery that they're trying to have completed. And this is incredibly beneficial for the financial performance of the hospital, the health system, the surgeon, depending on how you're financially, how the incentives are aligned, but it makes a positive impact on the bottom line. And so it's incredibly important to establish this committee and have this committee have authority that goes up ideally through the OR governance committee, and that it's a collaborative committee with surgeons, anesthesia, and nursing. And surgeons are holding each other accountable to who gets what block when, because they're going to use it. Otherwise, they lose it, and they really will lose it if they aren't abiding by the rules established by the subcommittee. And you have to make sure that you're holding people equally accountable to the rules, communicating with plenty of time so that people can reconcile or try to fix the issues that they're having as to why their block isn't being utilized. You never want to catch someone off guard with removing their surgeon access time or block schedule. So it's very critical to have this committee to be making those tough decisions and holding the organization accountable. It's also important as you think about how you're designing your block, the impact that will have on nursing, on nurse staffing, and anesthesia staffing. And so we recommend that you have the OR director, that you have someone from the nursing side also on this subcommittee, the block scheduling or surgeon access committee, and you have someone from anesthesiology also on that committee. And they're working together to not just think about how the impact for the surgeon and the patients, but the impact for the other people around the OR, so that you're controlling overtime and you're making sure that you have the right staff, not just staff, but the right staff for that service line or for that surgeon at the time when it is needed.